It's Colon Cancer Awareness Month. Let's talk on this next episode of Digest This.
Welcome to Digest This, the show that helps you revolutionize your digestive health. Here are your hosts, Dr. Liz Cruz and Tina Nunziato.
Hello and welcome to Digest This. I'm Dr. Liz Cruz and I've got the beautiful Tina Nunziato sitting right here by my side. Thank you so much for joining us. Whether you're a first-time listener or whether you're one of our regular listeners, we appreciate you so much and we're so thankful and grateful that you take the time to hang out with us for 15-20 minutes and listen to us. And maybe you're watching us also because we are on YouTube. So it is Colon Cancer Awareness Month, March, that's right. And the color is blue for that, which is why we have this backdrop in blue.
Every March.
Every March. That's right. So important. And it's one of the most preventable cancers. Whenever I find a colon cancer on someone, it really, really saddens me. The minute I see a tumor when I'm in someone's colon, it saddens me because this should not be happening. This should not be happening. It's 2025. We've been doing colonoscopy since 2000. And the only reason I know that is because it was in the year 2000 when I started my fellowship in gastroenterology, and colonoscopy as the gold standard for colon cancer screening had just been accepted. That had just become the gold standard, because up to that point we were doing flexible sigmoidoscopies, which is a scope, but it only goes up the left side of the colon, and then we would complete the screening with a barium enema. That was the gold standard for colon cancer screening. But then what happened was that after years of studies, researchers realized that people were getting cancer on the right side of their colon, and there were things that were not being caught on a barium enema. So I've always used the analogy that it was like doing half a mammogram on a female. Okay? We'll just do the left breast. I mean, the right breast doesn't need to be done. Okay? But so that's an incomplete exam. All right? Mammogram is both breasts. All right? So you've got, people were getting cancers that were on the right side of the colon, and it was like, what? How could this be happening? So basically, just to make a long story short, in 2000, it became the standard of care that a colonoscopy was the gold standard for colon cancer screening. And I still remember rotating through rotations during my fellowship, and some of the attendings were still in the old school. And sometimes it was hard. Like, we'd see a patient and then come and present the case to the attending. And if it was one of the old school, I'd be like, okay, this patient needs a colonoscopy. Well, I don't know. I think we should get a flexible sigmoidoscopy and a barium enema. It's like, yeah, but that's not the gold standard anymore. So anyways, that became the gold standard. So it's been 25
Yeah, and when people
25
first
years.
started getting them, again, it was not well known.
Yeah.
People, I remember even into the early 2000s, people still being hesitant to get these
Absolutely.
procedures.
Absolutely.
And I think it's become more well known now. There's more people getting them, but there's still a lot of people not getting them.
Yes, there are we're seeing patients that are in their 60s, even 70s, coming in for their first colonoscopy. And, and every once in a while I'll ask them, so, wow, how did you get away with not having a colonoscopy until now? They're like, some of them will say, my primary care has been trying to get me to do it and I've been putting it off. And others will say, I didn't know. So still seeing a lot of people that don't know. Okay. So it's so important. It's so important for to be aware that the colon cancer screening guidelines say that a colonoscopy, it's a preventive test, and age 45 is the age for starting.
And it keeps going down.
It does. It hasn't gone down officially, but they're talking about lowering it, especially in patients with diabetes. I saw an article recently. And then the other thing, the caveat to that would be that if there's family history that could change the recommendation. For example, if your mom got diagnosed with colon cancer and she was 30, then you would need a colonoscopy much sooner than the age of 45. So family history plays into it. But in general, if there's no family history, no risk, then 45 is the age. And like Tina said, at some point it may go down even lower as far as the age, because we are seeing we were seeing a lot of colon cancer. I mean, the goal is that we start seeing less and less, but I still do diagnose a case, of colon cancer, and that always makes me sad.
But you are taking off a lot of polyps.
Oh, a ton of polyps, and even on young people who are maybe coming in because they have other symptoms for which we end up doing a colonoscopy, and I'll find precancerous polyps on them. Someone 30 years old, 35. So yes.
So that's the whole point of the colonoscopy.
That's right. Get those precancerous polyps out of there.
That's right. So one of the reasons why we do this podcast every year too is because one of the big excuses we hear from patients is the prep. I don't want to do the prep. Okay, the prep is not that bad. Okay,
right.
I've been through it. Yeah, you got to drink. I mean, and they even took it now from the gallon. We're doing a Miralax prep now, so the quantity of the volume of what you have to drink is a lot less. But yeah, okay, you're on the toilet pooping all night. Get over it, okay? Get in there and get your colonoscopy done. The other excuse people use is, my PCP tells me to do a Cologuard, okay, instead of getting a colonoscopy. Now, we need to talk about these Cologuards because...
You want my opinion on the Cologuard?
I want your opinion
because
on the Cologuard.
Okay, so my opinion is that I am not crazy at all about the Cologuard. Okay, yes. It's a test that's out there. It's available. It's supposed to detect abnormal cells. So it's great. And it's great that we have it as an option, okay? Because it is something that is available for a certain group of people, okay? But in my opinion, it is a test that has been out there that could give you a false sense of security. If you get a false negative, okay, it's false. I mean, it was negative, and so I'm good.
You can wait 3 more years.
That test, if it's negative, does not mean that you don't have precancerous polyps in your colon, okay? Because first of all, it's a random sample of stool. So maybe that specific random sample that is being tested didn't have abnormal cells, but maybe the next poop coming along has abnormal cells. So number one, it's a random sampling. Number two, again, I will say, just because it comes out negative doesn't mean you don't have precancerous polyps, because it may be good at detecting colon cancer. In fact, I was reading some of the statistics as far as it being as sensitive as 92%, which is actually very good. However, you don't want to be at that point where you have colorectal cancer.
Yeah. Why are we waiting?
You don't want to wait until that, okay? Yeah. But it's the what I read as far as it detecting precancerous polyps, 42%. So what does that mean? Is that over 50% chance that you've got precancerous polyps in there that just weren't detected by the Cologuard. So the reason I don't like it and I'm not a fan of it is because I feel that it gives people a false sense of security that they're okay. And yes, the recommendation I think is to get it like every 3 years if you have a negative one. But again, you could still have precancerous polyps that are in there growing that you might never even know about because you're getting Cologuard, if you're getting Cologuards.
Yeah, and then you'll wait until your Cologuard is positive, and then you have to go do a colonoscopy to find out you might have colon cancer.
Exactly. Okay. Remember, the Cologuard, remember, colonoscopy is the gold standard, okay? Colonoscopy is the gold standard for colon cancer prevention, okay? We're going to catch colon cancer 98% of the time, okay? We're going to catch it. And while we're in there with the camera, we're also going to find polyps that we can actually remove and get out of there. And by doing that, we're helping you to prevent colon cancer, because it's those polyps, those precancerous polyps, that eventually over time will grow into a tumor and, colon cancer.
To me, that's the point of the colonoscopy.
Yeah.
The point of the because very rarely do you go into a colon and find no polyps. Very rarely.
Yeah.
Yeah. I mean, most of the time there's polyps, at least one,
Yeah.
if not more. And the whole point of the colonoscopy is to get those polyps removed. That's the whole point. Cologuard is not going to give you that. So, just this, oh, my doctor just told me to do Cologuard, it'll be fine. No, it is not fine. Stop doing Cologuard. Okay? Go see your gastroenterologist, get a colonoscopy.
Yes.
It's not that bad. Okay? And the medicine they use to knock you out is actually really nice. It's a really nice nap.
It is a nice nap. It is a nice nap. Hey, look, I even told my ex-husband, who was like, oh, I'm going to get a Cologuard. I'm like, don't do a Cologuard, do a colonoscopy, and he's like, nope, nothing goes in there. I'm going to get a Cologuard. I'm like, listen, don't do a Cologuard. Okay. So I couldn't be more passionate about that whole thing with the Cologuard, because colon cancer is one of the easiest cancers to prevent, and there is no reason why we should be diagnosing colon cancer anymore. Mm-hmm. There's no reason, because we have a method, we have a procedure, we have colonoscopy, available, and it's available, as far as I'm concerned, throughout the entire United States, and so a colonoscopy is a gold standard. Okay, so who would we do a Cologuard on?
No one. Just kidding.
Yeah. It's very rare. My list is very short.
I just got done being in the room with you with hundreds of patients. At no point did you recommend a Cologuard. So let's be clear.
Yeah, I mean, maybe
even for the elderly patients, you didn't recommend Cologuard.
Yeah, because I actually prefer a virtual CT over a Cologuard.
Right.
A virtual CT, because a virtual CT, I mean, yes, they're going to have to prep a little bit before, but let's say it is an older person who doesn't want to be put under, doesn't want, the risk of a colonoscopy, but wants to do something. My next one would not be a Cologuard. It would be a virtual CT.
Which is not fun.
Yeah, it's not fun, but in my opinion, they'll get a clean out, and the radiologist will be able to at least see polyps. Okay, so then will it mean that then they go to a colonoscopy? Yes, but at least if the and actually I did order a few virtual CTs over the last few months, and the reports I've gotten back were clear, and they had good cleansing, good clean out, and they were clear. So to me, I feel more comfortable with that report as opposed to a negative Cologuard, because a negative Cologuard doesn't tell me, well, are there polyps in there? Yeah. And even if it misses, because it has a high rate of missing precancerous polyps, you could have a big polyp growing in there, and you wouldn't know it. Yeah. And let me add the other thing too is polyps do not cause symptoms. Okay, because I've had plenty of patients throughout my years of doing this who have been on, well, I don't have symptoms, I feel good. Polyps are not going to cause symptoms. And I tell them, that's great that you feel good. We want to keep you that way. And that's why we should do the colonoscopy, so that we can go in there, and if you have polyps, we take them out. Well, wouldn't the polyps cause symptoms? They would ask, no. Polyps are not going to cause symptoms unless they're getting big, and maybe they're getting irritated, maybe they're bleeding.
But again, by that point, it's too late.
Yeah, I mean, you want to get in there and get those out of there before you get to the point where you have colon cancer. That's the whole purpose for doing it.
Please, just go get a colonoscopy.
Yes.
Please.
It's better for you to suffer one night of prepping than for you to suffer with a diagnosis of colon cancer, because now you're on a totally different pathway and journey. Now you're looking at surgery, chemo, radiation, not to mention the emotional stress of being diagnosed with cancer, right?
Right.
Pause, moment of silence here.
Silence.
Yeah, so
cancer sucks.
Yeah.
That's the bottom line.
Yeah, so get your colonoscopy, get it done. It's the gold standard. It's the gold standard.
And it's so simple.
Yeah, no one should be being diagnosed with colon cancer. So that's our push during this colon cancer awareness month. And actually, that's always our push, all year long, every day. So if you haven't connected with us, please connect with us. Go to our website, drlizcruz.com. There's a magenta color button. You can schedule a free 30-minute wellness consult. It's free, can be done from anywhere in the world because it's done over the phone. If you have any podcast ideas for us, topics, anything of interest, email us and let us know. We'd love to hear from you. If you haven't rated us, please rate us and please give us a 5. That way other people just like you will find us faster. And lastly, if you haven't subscribed, please subscribe so that you never miss an episode. Thank you so much for joining us, and we will catch you on the next podcast.
Thank you for joining Dr. Liz Cruz and Tina Nunziato. To learn more about their revolutionary products and services, go online to www.drlizcruz.com.